Today I'm going to speak about emergency caesarean section. So in an emergency section, sometimes it can be done before you are in labour, and in the second stage of labour. When an emergency section is decided upon, it can be quite traumatic. A lot of people enter the room. Each person that enters the room has a role in preparing you for theatre. It is an emergency situation, and there's a lot of different disciplines involved. The obstetricians, there'll be a midwife with you, the paediatric team and the anaesthetics team, along with the theatre staff who are on standby awaiting your arrival to theatre for your emergency. In an emergency, the doctor will explain the procedure to you to gain your written consent. If for any reason your written consent cannot be obtained, a verbal consent will be sufficient. Throughout the whole procedure, we will keep you and your partner fully informed of what is happening. A lot of stuff may be happening simultaneously. That's why there's a lot of people in the room. If you haven't got an IV access, you will have an IV access inserted. We need to give you medications to reduce the acidity in your stomach before you go to theatre. There might be another person who needs to put in a urinary catheter to keep your bladder empty while you are going to theatre for your caesarean section. There will be a doctor obtaining your consent. There may be the anaesthetic in the room explaining the type of anaesthesia he may use. If you have an epidural in situ, that may be used as the anaesthetic for your caesarean section. You may, depending on the emergency of the situation, be able to have time to put a spinal so as you are awake for the birth of your baby. And not very often, but sometimes the mums may need to be put to sleep. Throughout this, we'll keep you informed as best we can, both you and your partner. If you do have any questions, by all means ask. We may not have the time to answer it as best as we can, but always after an emergency situation, we will speak to you at length and debrief you on what has happened.